New research highlights an unintended and unfortunate side effect of common drugs. They can cause viruses to spread. Drugs are supposed to help get rid of diseases or at least alleviate the symptoms of them. Many medications can have side effects, but some are particularly serious. Researchers say anti-inflammatory drugs, JAK inhibitors, block an important immune response, which helps infected cells sound the alarm to neighboring cells, slowing viral spread and giving the body time to mount a broader defense. Earlier, I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group, to discuss this new study. Dr. Raut, thank you so much for joining me today.
Great to be here.
Now, can you explain what JAK inhibitors are and why they're commonly prescribed?
Well, JAK inhibitors, they're a class of medications that work by blocking the Janus kinase enzymes, which we call JAK enzymes, which are really critical players in the signal pathways to regulate our immune system and our immune responses. So by really inhibiting these enzymes, the drugs are effectively reducing the production of the inflammation cytokines that we need, which can also drive chronic inflammation. So what this mechanism does essentially is it makes it useful for autoimmune conditions because in those cases, the immune system, for reasons we really don't know quite yet, becomes overactive and it mistakenly attacks our body's own tissues. So that's why we use these medications for common conditions like rheumatoid arthritis, psoriatic arthritis, ulcerative colitis, and Crohn's disease. We also use these because they seem to be more convenient. They're more of an oral form of medication.
Now, as you mentioned, many people use
while
this.
A lot of biologic therapies.
Sorry to interrupt, but as you mentioned, many people use this medication for chronic inflammatory conditions like arthritis. How concerned should patients be and doctors be about the potential risk with this new report coming to light?
Right. So when people are taking these JAK inhibitors, I think it's important to really stay alert on the specific red flags that can happen with them. The big ones, especially with this report as well, is the concern about serious infections. So looking for symptoms like persistent fevers or chills or unusual fatigue and respiratory issues like shortness of breath or coughs. Because in those cases, these JAK inhibitors can dampen that immune response. And what may seem like a minor infection can really escalate quickly if we don't address it promptly. We also look for cardiovascular red flags that patients should really not overlook. Chest pain, shortness of breath, or unexpected swelling in the legs might suggest that there may be some other issues here, sometimes concerns about even blood clots, heart attacks, or strokes.
And what role do infected cells typically play in alerting the immune system? And how are these signals disrupted by these drugs?
So imagine if your immune system is really a network where every signal matters. So when a virus infects a cell, that cell will act like an early responder. It'll alert your body to the danger, and it does that by releasing special molecules called interferons. So the interferon is basically telling everyone else there's a threat here. We need to get ready. And that sends off another pathway called the JAK-STAT pathway. So this is where the JAK inhibitors come into play because they work to inhibit that pathway as well. So oftentimes you use a JAK inhibitor because there's unwanted inflammation and tissue damage. But in many cases, especially in a serious infection, there is wanted inflammation because we want that body to fight against it. So we've got a very delicate balance here. So on one hand, JAK inhibitors can maintain and manage harmful inflammation, but it could also make it too aggressive and remove the unwanted or the wanted inflammation that we need as well.
And are there particular red flags or symptoms that doctors could advise patients on these medications to kind of look out for?
I think the big ones that we do need to worry about are the ones that are more serious. So when we see persistent fevers, chills, very unusual fatigue, so just very, very tired patients, severe cough or shortness of breath, those are very concerning to us. And also cardiovascular issues like chest pains, shortness of breath, and unexplained swelling in the legs. That's what we get concerned about because that could, again, suggest heart attacks, strokes, or even blood clots. So those are very rare that we see, but they are still very critical, and we need to monitor them very carefully.
And are there alternative treatments available that don't suppress the immune system in the same way?
There are alternatives available. We do know that the JAK inhibitors tend to be quite common, but we do have biologic agents as well, like TNF inhibitors or IL-6 inhibitors, which all play a similar role, but they seem to be more targeted. Instead of blocking an entire pathway, they will tend to block one specific inflammatory molecule. So it's a much more targeted approach to decreasing inflammation that we do have. We also have drugs called DMARDs like methotrexate or hydroxychloroquine, which we've used for decades to manage arthritis. And they do have a very different pathway and don't directly interfere with this JAK-STAT pathway as well. And then on top of that, we do have the conventional approaches. So physical therapy and an anti-inflammatory diet and lifestyle modifications, they can all play a very critical role here in the overall health and bolster the immune system.
And with this report becoming a conversation, how important is it for people to understand the side effects with the medications that they're taking and not just think that it's a really long script on a pill bottle?
Yeah, I think this is the challenge here. I think it's good to understand, and as some of my mentors used to say, there can be a pill for every ill, but there is an ill for every pill. So really understanding the side effects of any medications you're taking is crucial. I think it's important to have a great conversation with it with your doctor or your pharmacist. You understand at least what the common side effects are and what the critical side effects are that you have to look out for. So those are the red flag side effects, and it's good to have that discussion with your provider.
Dr. Raut, as always, thank you so much for the time today.
Thanks so much for having me.